Do you know what HIPAA stands for?
I used to.
I do not.
I know it's health related.
I don't know what it stands for, but I do know it's about privacy laws for healthcare.
It protects their privacy.
Health information, patient privacy, something or other.
I believe it's Health Information Privacy Protection Act.
It actually stands for the Health Insurance Portability and Accountability Act. Are you glad that we have HIPAA?
I am absolutely glad we have HIPAA.
Yes.
Yes.
Absolutely.
I would say yes.
I think HIPAA is important. It's good that our health information is private and not given publicly.
Yes, I'm glad to have HIPAA.
It is keeping our health information private between us and our healthcare providers.
HIPAA is a very good thing for privacy. I love it.
What if I told you that HIPAA does not protect privacy? What would you say?
I guess I would have a lot of follow-up questions.
Well, I would think then that why do we even have it?
I'd be surprised. I'd be wondering what I've been signing.
So HIPAA actually is considered a permissive data sharing rule. And there are only 2 required shares of the data, and that's with you and with the federal government to make sure they're complying with HIPAA. Those are the only 2 required shares. But when it comes to permitted shares, it's an open book. For everybody else who holds your data, they have permission to share it should they choose to. You can ask them not to share it, but they don't have to agree to your request. How does that make you feel now?
It makes me feel like nothing's private.
I don't know. I guess I don't want it to be like a full black and white issue, like no, you can't have any of my information, or like yes, you can have everything.
That's a little less restrictive than I imagined that it was at the beginning. And I guess I'm a little concerned that people can share information that I don't necessarily want shared.
That should have been known beforehand during the time I'm speaking to my doctor and so forth.
Yeah, that is a real issue. Nobody should be sharing my personal information.
How do you feel about your medical data being shared with people who are not directly responsible for or involved with your care?
So yeah, that makes me a little nervous.
It's my information, and I kind of want to keep that stuff private.
I don't think that it should be shared with them.
I really value my privacy. I don't want my information to be spread across other people. I don't want other people to know about my health conditions or anything like that.
Minnesota has the strongest privacy law in the nation, state privacy law. HIPAA says if a state has a stronger privacy law, that law has to be followed. Over the last 7 years, our organization has fought the corporations, the Chamber of Commerce, the Minnesota Business Partnership, the researchers, the government, who all want to repeal the Minnesota law, get rid of it, and put us under HIPAA. And the Minnesota law says they have to get your consent unless you're unconscious. Do you think it's important for us to keep our Minnesota privacy law?
Well, absolutely.
Well, I would say that we really should protect it.
I think that's pretty important. I like that Minnesota has the most privacy in the law. I think that's a good thing.
Yes, most definitely. If that's the strictest there is out there, 100%.
More privacy for the individual is always a good thing.
Should you have been told the truth?
Yeah, everybody should be told the truth. If it's not HIPAA not protected, yeah, everybody should be told the truth.